Good morning. Welcome to the 2025 Texas State of Enrollment Conference. If you are in the lobby, we hope that you are able to join us in the webinar space.
Cảm ơn tất cả mọi người.
We are
Cảm ơn
officially
mọi người
getting
đã
started.
tham gia cái hội nghị này.
Koi, we are
Yes.
not starting interpretation quite yet. We will start
Okay.
in just a minute. Thank you so
Okay.
much. And with that, we are going to be simultaneously interpreting today's session in Spanish and Vietnamese. So before we get into our content, I am going to pass it to my colleague, Azucena Garza, and she will explain how to choose your preferred language for today's session. Thank you so much.
Thank you.
May we be assigned as interpreters?
Can we start? Yes.
With...
Can we start interpretation with Q and Vic?
Yeah.
Awesome. Perfect. Thank you. So good morning and welcome. Today we're going to have an interpretation available, like Katie said. And so to start, sorry, I'm trying to find, okay. So to start to access interpretation, please, if you are joining us from a computer, look at the bottom of your screen and you're going to see a globe icon that says interpretation. All you need to do is click when your preferred language, whether it's English or Spanish. And next slide, please. If you are joining us from a cell phone or a tablet, please look for the three dots that say more. There you will see the menu that gives you the option for language interpretation. You just need to click on your language of preference and then make sure you click done when you're done. I'm going to briefly ask my colleague Vic to go to the English channel. Those of you that selected it should be able to hear him. If you do not, please let us know in the chat.
Hello. Các bạn biết đó là có hỗ trợ
Yes.
phần
Thank you. And
dịch tiếng Việt. Cho nên các bạn mới yes. Các bạn
it should
yes.
be it's Q who's interpreting. You're going to give instructions after I'm done. Okay. And now I'm going to give instructions. Thank you. Now I'm going to give instructions in Spanish. Buenos días y bienvenidos. Estamos ofreciendo hoy interpretación al vietnamita y al español, interpretación simultánea. Para las personas que deseen tener acceso a este servicio, por favor pueden ver en la parte de abajo de su pantalla, hay un icono de un globo que dice interpretación. Si nos están acompañando desde su computadora, disculpen. Si están en su computadora, en la parte de abajo van a ver el icono de globo que dice interpretación. Hacen clic ahí y eligen su idioma de preferencia. Next slide, please. Si nos están acompañando desde un celular o desde una tableta, por favor busquen los 3 puntos que dicen más. Ahí van a encontrar la opción de interpretación de idiomas. Hacen su elección de su idioma de preferencia y hacen clic en listo para que funcione la interpretación. Le voy a pedir a mi colega Vic que brevemente se vaya al canal de español. Las personas que estén en el canal de español deberían escucharlo. Si no, por favor, díganos en el chat.
Next slide in Vietnamese. Xin chào các bạn. Các bạn biết là cái hội nghị này ấy, có cái giúp cho các bạn cái phần về phiên dịch bằng tiếng Việt. Nếu các bạn mà dùng cái máy tính ấy, thì bên góc phải ở trên các bạn bấm vào hình quả địa cầu. Đó là bước 1. Bước 2 ấy, là bên tay trái các bạn chọn ngôn ngữ tiếng Việt. Và bước 3 là các bạn thấy góc dưới bên tay phải thì các bạn bấm vào chữ Vietnamese. Next. Nếu các bạn mà dùng điện thoại đó, thì bước 1 là các bạn bấm vào chữ more. Bước 2 các bạn bấm vào cái ngôn ngữ phiên dịch mà mình muốn, viết là tiếng Việt Nam. Và bước 3 các bạn bấm vào chữ done. Thế là xong.
Thank you. Can we please be made interpreters? Thanks.
Thank you to our interpretation team for ensuring this year's conference is accessible. In addition, thank you to the St. David's Foundation for their generous support sponsoring language access, interpretation, and translation services for our conference. Translated resources will be available after the conference. If you are watching this video from the Zoom events lobby, to access interpretation in Spanish or Vietnamese, you need to enter the Zoom webinar itself by clicking on the link in the lobby. So if you are needing interpretation services, please make sure that you enter today's meeting. On the screen, you will see the schedule for the Texas State of Enrollment Conference. Please note that all times for the conference are in Central Time. After the conference, video recordings and slides will be available on the Every Texans website in English, Spanish, and Vietnamese. Attendees, you will receive an email post-conference with the link. Now, I would like to pass the mic over to Crystal Milam with Young Invincibles to kick off our first panel. Thank you so much.
Thank you so much, Katie. Good morning, everyone. Thank you so much for joining us for the Texas State of Enrollment's first session called Federal Budget Cuts and Policy Changes, Effects on the Texas Enrollment Utilization of the Marketplace. My name is Crystal D. Milam, and I am the National Policy and Advocacy Director here at Young Invincibles. And today I am joined by some esteemed presenters. Stacy Pogue, who is the Senior Research Fellow at the Center on Health Insurance Reforms at Georgetown University, and Shelby Gonzalez, Vice President for Immigration Policy at the Center on Budget and Policy Priorities. We will also be hearing from two Young Invincible storytellers via video. Full speaker bios are on the Zoom events page, and our chat monitor will share the link in the chat now. So for an overview of today's session, it will provide an in-depth overview of recent federal changes of the budget reconciliation policy rules that impact the marketplace. Participants will gain a clear understanding of key updates and timeline related to subsidies, eligibility, and other challenges that individuals may experience in the coming open enrollment period and beyond. This session will also provide an overview of the federal policy changes to the eligibility of qualified immigrant categories that impact their access to marketplace coverage. Next slide, please. To discuss today's learning session objectives, our first objective is to gain a deeper understanding of the complex policy changes affecting eligibility and enrollment in the marketplace. Our second objective is to learn the practical solutions for addressing these challenges and concerns with federal programs. Our next objective is to enhance their ability to effectively assist and keep the public informed. Our next objective is to learn from storytellers affected by the federal cuts in the budget reconciliation bill. And our final objective is to understand the changes of the categories of qualified immigrants eligible for the marketplace and other federal programs. Now, with these learning objectives in mind, we would like to remind attendees to stay until the end of the panel to complete a quick poll for a chance to win a $50 gift card. We will raffle this $50 gift card at the end of each session, but you must remain on the Zoom to complete the poll to be entered. You must remain on the Zoom to complete the poll to be entered. And lastly, there will be a little bit of time for question and answer at the end of each speaker's presentation, and then also a little bit of time at the end of the session as a whole. So let's go ahead and get this session started. I'd like to now turn your attention to a video from one of our young adult storytellers, Jada Lazino, who will share her experience with the ACA.
We cannot. Yes, we're gonna need to restart the audio on this one, Sarah. I think we need to turn the volume up on your computer.
Hi, I'm Jada, a thrill seeker with an admiration for the outdoors, surrounded by flora and fauna. I've cared for a flock of chickens for 5 years, a seasoned chicken tender. My Instagram is filled with photos from my trips and hikes through various biomes. Traveling in the wilderness is full of surprises. An accident could strike at any moment, which is an obstacle for me because I lack health insurance. Growing up, I had a health insurance plan with Texas Children's Health, but once you turn 21, you no longer qualify as a child. Needless to say, I lost my coverage. I was a 21-year-old college student who couldn't afford to make a simple doctor's appointment. Losing my coverage made me feel abandoned by the system. As a taxpayer in Texas, this is something I'm entitled to. Going without health insurance, even at my young age, casts an unnecessary shadow of fear. Everyone deserves health care. This is a predicament far too common amongst my peers. This frustration morphs into resentment toward the government. In other countries, healthcare isn't treated this way. At the end of 2024, Premier Secure Insurance Solutions came to my workplace and offered me a way to get free insurance. It's funded through your taxes, they said. The agent walked me through it on her iPad. I was 22 at the time and had no idea how to apply for health insurance. I felt like Texas cared about my health. My taxes were being used for an essential social benefit. I was so grateful they came to my workplace. I have 2 jobs and lack time and knowledge to sign up without help. They set me up with the insurance company Aetna. A couple months ago, I got a letter in the mail from Aetna. They will withdraw service from Texas by the end of 2025. Very disheartening news. It felt like someone threw me a life buoy to make swimming easier, only for it to be reeled back by a hidden string. Not only that, the letter failed to explain why Aetna was withdrawing service from Texas, leaving me searching for answers. Now I'm back to square one, getting new coverage. It shouldn't be this difficult. Health insurance should be easily accessible. Why did it take a company coming to my workplace for me to find out about a benefit I'm entitled to? This is the current reality of healthcare in our nation. We are so busy working and surviving that we don't have the time and/or luxury to prioritize our health. Humans need healthcare. Providers should put people over profit. Elected officials must listen to their constituents. They work for us. We vote them into power, and we can vote them out.
Wow, such a very powerful video from Jada. Thank you so much. Well, let's continue in our session. And I'd like to now introduce to you and turn things over to Stacy Pogue, who is a senior research fellow at the Center on Health Insurance Reforms at Georgetown University, to talk to us about federal ACA changes in policy. Let's all welcome Stacy.
Thank you so much, Crystal. I appreciate it. And thank you to Jada for sharing her story. I agree that it was a very powerful story. Sarah, slide, please. Quickly, Georgetown Center on Health Insurance Reforms. We're a group of researchers in the policy school. And what we try to do is improve the affordability of health coverage and access to health insurance. Maybe what's more important here today is that I'm a Texan and one of the biggest supporters of the Texas Enrollment Assistance Network and previously a certified enrollment assister here myself. Slide, please. I want to start with the big picture success that every single person in this webinar has been part of for the last many years. There are a record 4 million people enrolled in the Texas health insurance marketplace. That is a gigantic achievement. Those folks have affordable, reliable health coverage that gives them peace of mind, that they won't go bankrupt, right? If some sort of catastrophe hits. You can see on this chart a big growth of enrollment after 2021. That's when coverage got a lot more affordable because of enhanced subsidies, and we'll talk about those today. But also there were policies that made enrollment easier, and there were investments in the enrollment assister network that helped, again, get to 4 million people enrolled. Okay, slide, please. Here's the bad news. And spoiler alert, a lot of what I'll tell you today in the federal updates, it will be bad news. There are policy changes that have been adopted and ones that are rolling out that threaten to unravel a lot of those historic gains in health coverage that you saw in Texas and across the nation. So there are 3 policies that are all kind of overlapping and intersecting at the same time. And I won't continue to distinguish them, but I want to, through the presentation, but want to go through them here. First, the enhanced premium tax credits, the enhanced subsidies, are scheduled to expire at the end of this year, probably well known to all of you. Second, there was a new rule that was finalized this summer that adds some red tape and barriers to enrollment in the marketplace. That was called the Marketplace Integrity Rule. Also this summer, Congress passed a law. It goes by lots of names: the Big Beautiful Bill Act, the Big Bad Bill Act, HR 1, or just the mega bill, right? That also had a lot of cuts to Medicaid and Marketplace and will create barriers to enrollment. All 3 of those things together has led the Kaiser Family Foundation to project that 1.3 million Texans will lose their Marketplace coverage moving forward. And for those that stay in coverage, their costs are going to go up. And we'll talk about why. Slide, please. Okay, so first I want to talk about affordability and costs for premiums for next year. One thing we know for sure is that 2026 marketplace coverage is going to be less affordable. And there are 2 moving pieces on that, and I want to explain both. So I'm going to start on the left-hand side with gross premiums or full cost premiums. You've probably seen press reports that insurance companies are asking to raise their prices next year or planning to by substantial amounts. 20% on average, but lots of the big insurers in Texas are raising their premiums up to 40%. Premiums, insurance companies raise those gross full cost premiums in lots of years, most years behind the scenes. This year's increase is much larger than normal. But the thing to keep in mind about that gross premium is that it's felt by or paid by people who don't qualify for premium tax credits. Today, that's very few people. So it is important to know that the gross premium is going up. What's probably most important, though, for the folks that you're helping enroll who have low incomes and qualify for subsidies is that the subsidy enhancements are set to expire. That's the net premium, what you pay out of pocket after your subsidy. So that's going to expose, if it expires, most enrollees in Texas get these subsidies to very large premium increases. KFF says in Texas that it will double the cost of what people pay out of pocket per month on average. It again will depend for each person, what their income is, how many people are covered. But again, very large premium increases. Here's one example. A 35-year-old couple in Texas who earned $30,000 a year, or about 140% of the federal poverty level. Today, with the enhanced premium tax credits, they pay $0 premium, right? But if those expire, they'd pay $1,100 a year to maintain that same coverage. So again, as you well know, those enhancements to the premium tax credits have made coverage far more affordable, have made far more people eligible for $0 premiums, and those are at stake right now. Slide, please. And when I say right now, I mean right now. So the the federal government runs out of funding tonight at midnight. And if Congress doesn't pass a budget, or even pass just like a funding patch, the federal government or parts of it shut down. And to pass a budget or a funding patch through the Senate, they will need Democratic votes. They can't pass it on a party line, only Republican vote basis in the Senate. So Democrats in Congress have said, we will talk to you about funding the government as long as we can extend the premium tax credit enhancements as part of that effort. And so far, the White House and Republicans in Congress have said, no, that we can maybe or possibly talk about extending premium tax credit enhancements later at the end of the year through a different package, but it can't be part of the funding the budget shutdown debate that is happening as we speak. And I think they're, at least for everything I read this morning, at an impasse right now. But I assume that there'll be discussions minute to minute, and it'll be ongoing about whether there's any route as part of funding the government to extend the subsidies, or whether there's a route later in the year. Those are both possibilities. So you will have good questions about what this means, and I will have bad answers because it's not knowable right now because the situation's changing. So will Congress extend the enhanced premium tax credits? I don't know. It's an active dialogue. If they do it, when are they going to do it? I don't know. Right now, Democrats have said it has to be part of the discussion to avoid a shutdown or come out of a shutdown. I don't know if or when those positions will change, and if there'll be any negotiations on it that mean that they can get resolution before open enrollment. It's possible that they don't, or it's possible they extend it later in the year, or it's possible they expire as scheduled, right? There's lots of outcomes. And if they extend premium tax credit enhancements, they might not extend them the exact way they exist today. There's discussions in Congress about capping the higher income range. The enhancements let folks over 4 times the poverty level have access to these subsidies for the first time. And there's discussions about cutting that off at some income. There's also some discomfort from some folks about access to $0 premiums, which enhancements made much more available. So there's definitely some discussion about whether they would or could be modified. So for me and you, maybe what matters is when will a consumer know what they have to pay next year? How will they know? And that's not an easy answer either. Generally, insurance companies and the marketplace need to send you a letter before open enrollment about renewal, what your premium's going to be, what your estimated premium tax credit subsidy is going to be. This year, they don't have to include that information in the letters because it's in flux. So it's possible that a consumer won't know until they log on November 1st in open enrollment to see what their renewal premium is going to be. And if premium tax credits haven't been extended, that'll show what they qualify for under the regular premium tax credit system. And it might not be until open enrollment that they know. And it could be that it changes later if Congress acts later. So I just want to acknowledge how in flux the situation is and how that's challenging for you and your clients. Okay, slide please. The next thing I want to do is talk about policies that have been passed, that were adopted, but have been put on hold. And CMS has clarified that these will not be in effect for this open enrollment this fall because they were challenged through a lawsuit and a court put them on hold. It's temporary, but it's for the time being, for a while, until the litigation's resolved. And CMS has said they won't be in effect. But I'm going over them here because I think you've probably heard about them already, and I want to just make sure you move them to a place where they won't affect your clients right now immediately. So the $5 monthly fee for people who would have been auto re-enrolled if they don't take action this open enrollment and would have qualified for a $0 plan, there would have been a $5 monthly fee instead of the $0 plan. which is not going to happen now, not for this open enrollment. There were also adopted increased income verification requirements in certain circumstances. There were additional verification requirements when you're applying through a special enrollment period to make sure somebody's eligible for that special enrollment period. That won't take effect immediately, that are on hold. And another one was a provision that allowed insurance companies to make you pay any premiums you owed that you were behind on from prior coverage, make you pay all that balance and debt before you enrolled in coverage. And that has also been on hold. So again, policies that are adopted that are not in effect right now, just want to flag those. All right, slide please. Now I'm switching to things that are in effect and are happening, and in some cases have happened. So here are some current changes that in effect now and in 2026. Already in effect, our DACA recipients have become ineligible for coverage in the marketplace and premium tax credits, and their coverage will end in Texas today. Shelby, a preeminent expert, Shelby Gonzalez with Center on Budget, is speaking next. And I'm not going to go into detail on any of the immigrant eligibility pieces because you have the expert who's coming up to talk about those. But I just want to have a good list of key things you need to know in one place. Another is that the low income special enrollment period has been eliminated. The one that we've had recently let folks under 150% of the federal poverty level enroll in any month. That is already gone. And there's another provision that takes effect that effectively makes those types of low-income enrollment periods, special enrollment periods, it will effectively prohibit them moving forward too. And there's also less time to resolve income inconsistencies. The automatic 60-day extension has ended. Okay, for 2026, we're going to see some changes. One is that certain lawfully present immigrants with incomes below the poverty line will become ineligible for PTCs and, premium tax credits. And I know Shelby will get to that. Another one is that when you take your premium tax credit in advance, and most people do to make coverage affordable, there's been a limit to how much you have to repay at tax time if you estimated your income incorrectly. And that repayment limit that protects low-income folks and middle-income folks from surprises at tax time, that's been eliminated for 2026. So people whose actual income is higher than they projected, when they file their taxes for 2026 coverage, which will happen in spring 2027, if their actual income is higher than they projected, they will owe back all of the excess advanced premium tax credits that were paid for their coverage for 2026. There's no repayment cap that protects them. This is felt in the first time when you file taxes in 2027, but it's effective for plan year 2026. It's for the coverage folks will be enrolling in now. So important that folks understand this new financial risk that they're undertaking. Also important to know that people don't have to repay tax credits if their income was lower than they projected. So if you project income over the poverty line, that lets you gives you subsidies, access to subsidies, but your actual income at the end of the year falls below the poverty line, those folks are not required to repay. Same is true today. Those folks are not required to repay their premium tax credits. Okay, slide please. All right, another thing changing for 2026 is access to catastrophic plans. So in the marketplace, there's the metal tier plans, bronze, silver, gold. There's also a plan called a catastrophic plan. And a lot of people haven't enrolled in those, in part because they're currently pretty limited. Only people under the age of 30 can enroll, or people with specific circumstances like some sort of hardship. But they cover essential benefits. They have no cost care like all ACA plans. They just have really high costs. You can't use premium subsidies for them. You have to pay full cost. And the deductibles are really high. Next year, the individual deductible will be about $11,000, and the family deductible will be about $21,000. And there's very few services before your deductible. So folks who enroll today tend to be higher income affluent individuals, right? So what's changing for 2026 is that CMS, the CMS, the agency that oversees the marketplace, is going to extend a hardship exemption to people who don't qualify for premium tax credits or cost sharing reductions, so that they can enroll in catastrophic plans if they want. So it's people under the poverty line, so very low income folks, or over 250% of the federal poverty level. You would have to apply through healthcare.gov, which will be new if you can apply online for a hardship exemption. And there's also a paper application. I will say that there's some different folks, different experts have different readings of whether this hardship exemption would allow lawful immigrants under 100% of poverty who are losing eligibility for tax credits, whether it would allow them to enroll in a catastrophic plan. And when we know the answer, a final answer, I'll share that. But I want to flag that even if that was true, remember the folks who are losing coverage are in poverty. They have very, very low incomes, and these catastrophic plans have both full cost premiums and remarkably high deductibles. So it is um, it would not be a plan that is built for and designed for very low income folks to be able to afford coverage or care. And we don't know where insurers will offer catastrophic plans in 2026 yet. They don't have to be in every county in Texas, and we'll find out. Okay, slide, please. And I think this is my last policy slide. It's to preview changes coming in future years for 2027 and 2028. So in 2027, open enrollment will be shorter. So a year from now, fall 2026, for open enrollment for coverage 2027, will run November 1st through December 15th. And more immigrants who are lawfully residing will lose eligibility for premium tax credits, which they've had since the ACA passed. And again, I think Shelby will cover that thoroughly. In 2028, there's two big changes coming to enrollment. Automatic re-enrollment will be eliminated. People who need to renew their coverage in the marketplace will have to come back in some manner and proactively verify their subsidy eligibility and actively re-enroll to maintain their coverage from one year to the next. And in Texas and everywhere, some folks have really relied on automatic re-enrollment because it's so streamlined and so easy to maintain coverage. So that'll be a big change. Also in 2028, provisional eligibility for subsidies is eliminated. So if you apply online and get a data matching issue, there's some issue with your income and you need to send in information to verify your income and resolve that inconsistency, today you can get your coverage now and work to resolve that inconsistency. But in 2028, you will have had to resolve any data matching issues before your premium tax credits can begin. And I think, sorry, is that next slide? I think it's just questions if there's time, and there might not be because I see Crystal.
No, this is actually a good sign. There is a little bit of time for maybe one or two questions. Stacy, I've heard you present many times, and I am just always so impressed. So if anybody has any questions for Stacy, please use this time to enter them in the chat now. Give it a few moments for some questions.
Sure.
I always feel like I learned so much from you, Stacy, things that I probably have heard before, but the way you deliver them, really, I'm like, oh, okay, this is really sticking here.
I have to hear it 5 times too.
You really do. And like you said, things continue to evolve just so much, and they're getting ready to evolve again. And I love your honesty about with the things that you don't know. So I like that.
We're all in a bad position with how much is uncertain right now.
That is very true. So we have a question from someone that mentioned, do public charges affect immigrants who apply for their children?
That is an excellent question. If Crystal and team let me, I'm going to kick that to Shelby. Again, you have a preeminent immigrant eligibility expert coming up next. And
Okay.
she is going to be great at being accurate when answering that question.
Okay, we will save that one for Shelby. And we have another question from Elizabeth Colvin. Are there any changes to the tax reconciliation? Will it be a hard stop during enrollment if people didn't file for taxes in 2024?
Ooh, okay, this is a good question, Elizabeth, and I'll only have half an answer, but I can send more. So the rule I talked about that it was adopted included a change to subsidy eligibility if you failed to reconcile your taxes from a prior year. And it was going to move us back to where if you failed to reconcile it in any 1 year, you lost subsidy eligibility. Right now, it had been 2 years. And the court had a really, to me, ununderstandable answer to that question, um, where it said there was no statutory authority to to remove coverage for subsidies if you failed to reconcile. And so whether we're in the 1 year or 2 year and what's going to happen isn't clear to me, but that doesn't mean it's not clear to folks who are experts in that area. So let me work to get a better answer about if it can be known to back to this group. And I will email you, Elizabeth, the writing that I've seen on that. But I think the lawsuit threw that particular one up in the air more than most.
That is awesome. We definitely will make sure we share these presentations with everyone after this presentation today. Someone had a really great question. I think maybe a simple, quick question is, when is open enrollment this fall for 2026?
Oh, geez, Louise, I'm going to say it and then somebody needs to jump in if I get it wrong. I think it's November 1st through January 15th. I am so scared to say that out loud that I'm going to be wrong because it keeps changing. Would anybody come
That's
off
right.
mute if I got that wrong? Thank you, folks in the chat. I'm so terrified that I'm going to mess that one up. Yeah. So it was proposed to change. It is not changing this year. This year, November 1st through January 15th. I appreciate the softball question. It's embarrassing that I felt uncertain.
No, no, no. And I'm not sure this is a question that you may want to take or save this one for Shelby. But another question is, who are lawful immigrants?
That is a good question. And it's changing. I'm going to leave that one for Shelby.
Okay, we shall also leave that one for Shelby. We have about just 2 minutes remaining here in this session. Are there any other questions? I think I just saw one. Okay, somebody mentioned the deadline that you were right on that time frame for open enrollment, Stacy.
That is great. I appreciate all of the support in the chat.
That's right.
That one.
Let's see. Are there any remaining questions? Okay.
All right. Well, thanks for the time, guys. If there's anything I can do for you, you've got my email address in this presentation, and good luck during open enrollment. It's a challenge in every year. It's always there's always ups and downs. It's always in flux. But this year I know it'll be more than usual.
Thank you. Thank you so much, Stacy. Thank you for that awesome presentation. I mean, your honesty. Well, let's go ahead and move on in this session. We have another wonderful video from a young adult who's going to share her experience as it relates to immigration. This young adult's name is Carla Salinas. So please turn your attention for this video.
I have not had a proper doctor's appointment in years. I can't even remember the last time I got a checkup. Hi, I'm Carla. I'm a student at Texas State University. Not only am I a woman, but I am an immigrant and a part of the LGBT community. I moved to the United States when I was 5 years old and only now became a citizen at 21 because of the financial burden. But that's not the only thing I've had to overcome. When I was a kid, I was under Medicaid thanks to the ACA, but I remember my parents complaining about how many doctors wouldn't accept the insurance. When I turned 19, my parents told me that I no longer met the requirements under the insurance, and I just never looked into getting my own. I didn't know where to start or where to look, so I just didn't. I had a coworker once tell me to look into Texas Women Healthcare because that would either be very cheap or free. However, at the time I was also working at a doctor's office and I found that Texas Healthy Woman Insurance rarely covered appointments, that I would have to look into specific clinics that accepted the insurance, and I felt like it was pointless to even look into that insurance because I couldn't afford to be paying for something I was not gonna use. I haven't had a doctor's appointment in years. I can't remember the last time I had a checkup. I also noticed how impossible insurance providers seem to make it for clinics to contact them. I've spoken to the same doctor that I worked for, and he mentioned that insurances make the process very complicated, kind of like if they hope that we don't keep pushing the claims. He also mentioned that the reason many clinics don't accept Medicaid or CHIP is because if the insurance doesn't pay, they're not allowed to bill the patients. So they just lose money. Now, as a college student, I've looked into food stamps since I'm living away from home and I'm on a part-time job, so I'm kind of living paycheck to paycheck, but the process for food stamps and other benefits is just so lengthy and complicated that I just stopped. Taxes for this sort of stuff gets taken out of my paychecks that are already small, but I don't actually receive the benefits for whatever that money is getting taken out for. I feel frustrated and helpless. My parents and I came to this country for the opportunities it has to offer, but how can we take those opportunities if we can't even take care of our health with affordable health care? Elected officials need to listen to their constituents. We voted them into power and we can vote them out.
Wow, that is such another really powerful story. I think Carla's story just echoes so many of the experience of so many people in this country, not just immigrants. So thank you so much for that really insightful video, Carla. Now, I'd like to now turn things over to Shelby Gonzalez, who is the Vice President for Immigration Policy at the Center for Budget and Policy Priorities. We have heard so many great things about Shelby and her expertise. So I'd like to now join you all. Welcome Shelby to start her presentation.
Thank you so very much. And I just want to pause for a second and also thank Jada and Carla for sharing their stories. I got to tell you, they're very touching. And for me, it, there's so many parts to their stories that I feel I connect with very deeply. And it reminds me and grounds me in why all of this work is so important. And it reminds me, of all the work that you all are doing each day. So I just really want to stop and thank you all for your dedication to making sure that people um, in Texas have access to health coverage. And I've always been a huge admirer of the work of the network of folks that are so dedicated to making sure that people are able to break down the barriers, many barriers that exist in Texas and that exist across the country in many places. Now, Texas is the home of my son, my daughter-in-law, my grandson, and I'm even more grateful for everything that you all do as now I have this new connection to Texas and try and get there as much as I possibly can. So thank you. Thank you. Also want to thank Stacy. Wow, that was a lot to cover. And I wish that, because I know that Stacy just provided an overview of a tremendous amount of challenges and so much change that's happening that you all will be facing as you're trying to help people find access to health coverage. And I wish I had better news as I will take a moment to tell you a little bit about some of the changes that were made in the reconciliation bill. I'll call it OBA. um, and it, my focus is going to be on the intersection of health coverage programs and people who are immigrants and their families. There was a lot changed in this bill that extend way beyond this narrow group of challenges that present themselves. But I'm going to really focus and try and take a deep dive. I will do my very best to remember to answer the question about public charge at the end of my overview of what changed in OBA, or what will be changing in some cases. Because as Stacy mentioned, a lot of the changes are kind of scattered in time in OBA, and some of them changed immediately, and some of them will be changing soon. So I will try and make sure to share when things are happening. I will go over the question that was asked about who's lawfully present, who meets that definition, as it relates to health coverage programs, in my planned remarks. So next slide, please. So first, I just want to kind of take a step back and just say that the changes, when we take a step back and think about what OBA did, in terms of making new barriers for people who are immigrants to accessing food and health coverage, it really is a stark departure from a tradition that our nation has had in ensuring that people who our nation has agreed to provide humanitarian relief to can access really key supports like health coverage and food assistance. So what happened was that the kind of underlining laws that have restricted eligibility based off of immigration status for more than a couple decades, since 1996, there were laws in place that really said we are only going to allow certain people who are immigrants, and we're going to define this group as qualified immigrants. That law stopped short because it was a very restrictive law, and wanted to make sure that only certain immigrants were eligible. That law understood and saw that people who are here for humanitarian reasons, like people who are refugees, people who've been granted asylum, victims of certain trafficking because of work, certain certain victims of domestic violence, that these are individuals that need access to supports, and the law made sure that those individuals would still be able to access programs. Well, OBA took a very different stance and really cut out access to eligibility for these groups. Next slide, please. What it did was for Medicare, Medicaid, and CHIP, ACA Marketplace, tax credits, and SNAP, they all really said everybody, as it relates to federal funding, will no longer be eligible unless they were a U.S. citizen, a lawful permanent resident, otherwise known as a green card holder or LPR, you'll hear me say sometimes. So lawful permanent residents, people from the Compact of Free Association Nations, which is a small group of nations, and certain Cuban and Haitian entrants. Everybody else would no longer qualify for Medicare, ACA, premium tax credits, SNAP, and federally funded Medicaid and CHIP. Next slide, please. So I'm going to start with Medicare. I'm going to go through it very quickly. I'm going to go into Medicaid and CHIP, and then I'll go into ACA Marketplace coverage. I know that you all are mostly focused on ACA Marketplace coverage, but I know that it's super important to understand kind of the whole panorama, right, of who, other eligibility for other programs, because when people come to you, they come in families and they don't always fit in nice, neat boxes, right? There might be somebody who has Medicare, somebody who, and also for one of the requirements for eligibility for premium tax credits in the marketplace is that you're not eligible for Medicaid or CHIP, right? You first look at Medicaid and CHIP, and then if you're not eligible for Medicaid or CHIP, then we see if you're eligible for ACA Marketplace. So it's helpful to understand what the other programs are doing in terms of coverage as well. So the mega bill, or OBA, also ended new eligibility for Medicare for most categories of lawfully present immigrants, including no longer allowing people who are refugees, people granted asylum, to access Medicare, even though to access Medicare without a premium, that Medicare Part A that so many people depend on in our nation for health coverage in their later years, um, you have to pay. You have to show that you're paying into Medicare for a decade. You or your spouse have paid into Medicare, and then you would have to meet all of the different requirements to get Medicare. Now, even if a person who's a refugee today says, I've done my work history and now I want to get Medicare, I've paid into Medicare, in my taxes for a decade, that person will, if they're newly applying for Medicare, that person's no longer eligible. The same is true for the people who currently are enrolled in Medicare. There's going to be more of a delay in terms of rolling people off of Medicare, so that by January 1st, as people renew Medicare, by January 1st, no longer will a lot of people under different immigration statuses that are lawful in the US qualify. The only people who will be able to get Medicare newly today are US citizens, lawful permanent residents, again, green card holders, and people from the COFA nations, as well as certain Cuban and Haitian entrants. Next slide, please. The mega bill also takes away federal funding for Medicaid and CHIP for immigrants living lawfully in the United States. So the reconciliation mega bill ends federal matching funds for Medicaid and CHIP for most categories of immigrants. So this does not mean that Texas has immediately going to adopt these changes. Texas has to take some type of step to end eligibility. So to the extent that eligibility is in your state laws, for example, Texas would have to change state laws if they say without federal funding, we can no longer afford to pay coverage for people who do not meet this new narrow group defined as eligible for federal funding by the mega bill. This change happens starting October 1 of 2026. So it's not going to be relevant today. These are changes that are coming starting next year on October 1st, about 1 year from today almost. From that point on, only US citizens, lawful permanent residents, people from COFA, and Cuban Haitian entrants. And at the state option, states can continue to get federal funding to implement the state optional programs that allow people who are lawfully residing to, if they're pregnant or children, and in the case of Texas, you do provide coverage to children and pregnant people who are lawfully residing. So that federal funding is still available to Texas even after this change takes place. I'm going to go to give you a sense of who is no longer going to be eligible for the federal funding. I am including everybody in this slide who's currently eligible for federally funded Medicaid or CHIP, and now we're kind of crossing them out so that you can see, because we think it's a helpful visual to see who's losing out of coverage. So today, the people, you know, everybody listed here is still eligible for based off of immigration status. Obviously, you have to still meet all of the other criteria to be eligible in Texas for Medicaid or CHIP federally funded services. But all of the folks that are crossed out are no longer going to be eligible, except, of course, children and people enrolled because of pregnancy-related coverage. And now we'll get to the ACA marketplace. So the mega bill takes away ACA marketplace premium tax credits from immigrants living lawfully in the United States. And I just want to pause and say that one more time, because there's been a lot of rhetoric that's been happening, and a lot of people are saying that the mega bill has ended coverage for people who are undocumented, and that is not true. In order to enroll in ACA marketplace coverage, you have to have a lawfully present status. And in the next couple of slides, I'm going to walk through what that means for the purpose of eligibility in the ACA marketplaces. And to be eligible for premium tax credits, you also have to have a lawfully present immigration status. The mega bill does not close the door to enrollment in ACA marketplace coverage for people who remain eligible based off of having a lawfully present immigration status. But we all know that without access to premium tax credits, it would be extraordinarily difficult for most people to be able to afford coverage in the ACA marketplaces. So as a result of that, many people are going to be no longer eligible starting January 1 of 2027. So not for this coverage year, but for next coverage year. You would have to be either a U.S. citizen, a lawful permanent resident. You would have to be from one of the COFA Free Association nations, which and living in the U.S. and certain Cuban and Haitian entrants. So here we go to the question that we were asked. What is the status? These are the statuses, and similar to what I did with the Medicaid slides, I thought it would be helpful to just list everybody out that currently meets the requirement that is known as lawfully present. And in this chart, and we have 2 pages because there's a lot of different statuses that allow people to meet the lawfully present status to qualify for enrollment in the ACA marketplaces and premium tax credits. What we've done is we've crossed out everybody that as of January 1st of 2027 will no longer be eligible based off of the immigration status to be able to get premium tax credits. So in this table, this first listing of people, they are the folks that are considered to be eligible to meet also the eligibility requirement for Medicaid and CHIP, the qualified immigrant standard. So you will see that the folks that I've been talking a lot about, people who are refugees, people who've been granted asylum, certain victims of trafficking, and others will no longer be eligible for premium tax credits come January 1 of 2027. In the right-hand column of this table, there's a lot of other folks that are lawfully present. They have a status that the U.S. government has said, we know that you're here. We have given you permission to be here, and you are in status, but no longer will you be eligible to get premium tax credits come January 1, 2027. This includes folks that have temporary protected status. It includes folks that have deferred action for a variety of reasons, except for DACA, as Stacy mentioned beforehand. People with DACA lost access to being able to purchase marketplace coverage and lost access to premium tax credits already ahead of this because of a change in a rule. There were certain people who are recognized by the U.S. government to be in the process of gaining a status. And during that process, some of them even have access to work authorization. because there's a recognition that people have to go through a process and have to wait sometimes because there's a lot of backlogs in our system. So there is a lot of applicants that are also lawfully present, and all of those applicants will no longer be eligible for premium tax credits once January 1st, 2027 begins because of the changes in OBA. Um, right now, they will still continue to qualify for this next coverage year, but no longer will they qualify for coverage starting in 2027. A change that's happening more recently, and Stacy mentioned it, is that, and I want to pause and just say that this is a provision that's going to be extraordinarily harmful in Texas, and it's because in Texas, the the requirements for enrollment based off of immigration status for Medicaid are very strict. Not only do you have to be a lawful permanent resident, for example, for 5 years, you have to also have met a 40 quarter work requirement. So in Texas, there was a lot of people who are ineligible for Medicaid because of their immigration status, but they are lawfully present, and therefore there there was an opportunity to be able to get premium tax credits even if their income was below the federal poverty line. This provision ends starting January 1 of 2026. So because it's such a complicated provision, I'm just going to say it again. Under current law, if you have a lawfully present immigration status, but you're ineligible for Medicaid because of your immigration status, you are eligible to purchase marketplace coverage and get premium tax credits, even if your income is below the poverty line. So, for example, somebody with a green card, a lawful permanent resident, who in Texas maybe even has had that status for 6 years, but they haven't met the 40 quarter work history requirement yet to qualify for Medicaid. They would still qualify for premium tax credits, even if their income is below the poverty line. This provision ended, and the bottom line is that nobody will be able to qualify for health coverage, premium tax credits, after January 1 of 2026 if their income is below the federal poverty line. Next slide, please. Um, I'm also going to mention a few executive actions that are happening just because I think it's helpful to put things into context to just get a sense of some of the other concerns that people who are immigrants and their families are facing right now. But because I didn't have anything on public charge, and we did get a question about public charge, I'm just going to mention right now that public charge, I'm going to back up and say, is a policy that's really an immigration policy. And just in case some people don't know what public charge is, I'm going to just say that there are certain people when they're going to try and become a lawful permanent resident, or maybe they're trying to come into the US from outside of the US through a lawful pathway, they have to go through a public charge assessment. And what the government is trying to do during this assessment is to make sure that the person is not going to become what they call a public charge. And right now, that means that the person is not going to rely on the government for subsistence. And how that is done, nothing has changed changed in public charge by the Trump administration so far in this round of this administration. So what that looks like is that if a person is dependent on the government and they need to get cash assistance like TANF or general assistance through a state, if a person is maybe they get Medicaid but in an institution, so to pay for institutional care in a long-term care facility like a nursing home, in those limited cases, if a person looks like they are going to be at risk of being a public charge, either because they have used those types of services in the past for themselves, or are currently using those services, or because of then they could potentially have a negative factor. It's not determinative. They still have to look at the totality of circumstances, including age and income and other items. Then the immigration official could say, we're gonna pause, because we have this concern, and a person may be determined to be assessed as being a risk of becoming a public charge, and that might harm their chances of being able to adjust their status to become a lawful permanent resident, or in the case, coming into the US. So nothing has changed by the Trump administration right now. We're on slide 11, by the way. Nothing has changed in my slide deck is the next slide. Nothing has changed right now on public charge, but what we are concerned. We're keeping an eye out for any potential changes. Next slide, please. Slide 12 on my deck, the one that says executive actions creating fear, confusion, and barriers. So there have been a lot of different executive actions that, so next slide, please, that have also come out. So there have been some concern. So any of these changes is contributing to this atmosphere of fear, and a lot of people, for people who are immigrants and their families. And let's be clear, right? There's other actions outside of the public of benefits, where a lot of families are extraordinarily concerned that that they or somebody in their family could be harmed because of the aggressive immigration enforcement that's happening. So things like the government having several attempts of using um, private information that's provided in different benefit programs like Medicaid, or even in our tax system, through the tax system. When information that's collected for those programs is being shared with other places in the government, including potentially the Department of Homeland Security, people are very fearful. And there have been lots of different attempts to share information that's collected from one benefit program with other parts of the government. There's all sorts of different court cases that are challenging that, and those are all in different places right now. And there are some places where there is a pause to that. But it's difficult from the perspective of an individual that's helping somebody navigate even the marketplace, to be able to say with full-on reassurances that, oh no, the information you share here, it's never going to be shared with anybody except for the purposes of benefit programs, because there's so much in flux right now. So I just want to acknowledge that and say that that's a reality. What I can say for people who are very concerned about sharing their information, is that the way that the applications are designed is that people who aren't applying for benefits for themselves are not supposed to be forced to disclose their immigration status. And I can see that I am running out of time, so I'm going to pause there and just note that there are other challenges that have come up that could also be fears that people have as they're navigating the application process. And then I'm just going to go ahead and stop there. Note that I have in the last slide, I have my contact information. I'm glad to be a resource if people have questions. And then I'll just pause for you.
Thank you so much, Shelby. You actually answered two of those questions from earlier already in your presentation. We may have time just for one more question. If anybody has one more question they want to enter into the chat for Shelby while we have her, please feel free to do so now. Let's see. Someone mentioned, so an undocumented mom can't apply for her citizen children.
No, a person who's undocumented can apply for their citizen children to get coverage. And I'm assuming this is a question about the marketplace. If what they would have to do is they would have to have an ITIN. So they would have had to do that so that if they're the taxpayer needs to provide just they need to say that they will be getting they will reconcile a tax credit, right? So if they have an avenue to provide coverage. A lot of times, children are eligible for Medicaid or CHIP, and the parents are not. So again, you could go through the application process, and you will have to provide certain information about the family, but that undocumented mom should not be required to disclose any information about her own immigration status. The eligibility is going to be based off when I talk about eligibility based off of status, it's for the individual who's going to get the benefit. So to the extent that child is a US citizen or has some other type of immigration status that qualifies them, the mom who's undocumented can complete an application on behalf of their child. And that application could be in the marketplace, and it could be in Medicaid or CHIP. If it is in the marketplace, then remembering that the person needs to have a mechanism to be able to reconcile the tax credit. So that would mean either if they have a social security number, which most people who are undocumented would not, maybe unless they were issued a social security number beforehand. Otherwise, they would have to have an ITIN, and that ITIN would then allow them to be the taxpayer in the unit and agree to reconcile tax credit that is awarded to be able to get premium tax credits for their children.
Thank you. Thank you. That is such a really great answer with really detailed information that I'm sure will be helpful to everyone. As Shelby mentioned, her contact is listed here in her presentation, and we will make sure to share these slides with everyone so you guys can all have the presentations and have the slides. Shelby, thank you so much for this really great presentation. We were so happy to have you. I'm going to go ahead and turn things back over to Katie, who will lead us in our poll.
Yes, thank you so much, Crystal, Shelby, and Stacy. Folks, if you do have any more questions, please continue to put those in the Q&A box or the chat box, and we will be following up to make sure all of our questions are answered today. But now it is time to officially launch our poll. And so if our Zoom administrator could launch the poll for everyone. With this poll, if you could please respond to these 3 questions. This is also the way to be entered in for our raffle for our $50 gift card for attending today's first session. We'll give it just a second, and then we will officially spin that wheel. So thank you for joining us for our first session today, for asking really great questions, and then, of course, for completing this poll. And then on the next slide, we just wanted to say thank you again, folks, for joining us today. Our next session starts at 10:30 a.m. Central Time. We will cover it will be a SEP deep dive. We'll talk about best practices and communication with care, and this will be led by the Texas Association of Community Health Centers. And so again, our next session will be starting at 10:30 a.m. Central Time. So you will have about 15 minutes in between sessions to hopefully grab some more coffee, get something to eat, to stretch. And it looks like our polls are coming in. Thank you so much. I'm actually going to ask my colleague Simona to spin our giveaway wheel. We have pulled the attendee list from today's session, and just give it 1 second and we will announce our first giveaway winner. So much anticipation. And our winner is Elias Ramirez. Congratulations, Elias. hopefully you are here and you can hear my voice. And as a reminder, we will be doing a giveaway after each session today. And so there are still 5 more chances to win a $50 gift card. Ooh, looks like Elias is like very excited. We're excited for you. And thank you all again, and we will see you at 10:30. Talk soon. Bye.